Hello, welcome to week 2 of your Medical Language 2 course. This week we're going to be covering chapter 18, and this entire PowerPoint will be available for you to review, but I'm going to kind of go over some of the highlights of the chapter that I want you to focus on this week. This week we're going to be talking all about the terminology that's related to geriatrics. So we're kind of looking at the other end of the spectrum. Last week we looked at pediatric patients. This week we're going to look at geriatric patients. So geriatric refers to the elderly. As most of us know, the elderly people are living a lot longer than they ever did before. And because of that, we're going to be seeing a lot more illnesses and things like that. They are also one of the groups that uses more drugs than any other age group. There's also a problem with what we call polypharmacy, where they may go to more than one pharmacy or more. They're obviously going to go to a lot of different doctors. You'll find that many elderly people are going to go to a primary doctor, but then several specialists as well. And on top of that, then they're also getting their medications filled at more than one pharmacy, which can be detrimental. It's really, really important that they communicate with their doctors and their pharmacies so that everybody knows what medications they're taking. There can be a lot of interactions in between. One of the things that a lot of pharmacies offer is what they call a brown bag event. A brown bag event basically means just that the patient comes to the pharmacy with a bag, and inside that bag are all of the prescriptions that they're taking. And that gives the pharmacist the opportunity to go through them and look at them with the patient and, identify any, possible harmful interactions and things like that. As you go through this week's material, pay special attention to some of the different types of terminology related to our geriatric population, specifically some of those that refer to some of the different disease states. So let's just kind of go through it and kind of look at a few of these. This is the first set. Amnesia is on here. Kind of unusual to see that in this list, but what they're referring to when they say amnesia or loss of memory is that amnesia that occurs with some of the disease states. So things like Alzheimer's. So when you see that, don't think it's like 51st dates or something like that. It's actually a byproduct of some of the disease states. Here's another one where we have dementia. So dementia and amnesia kind of go together in a lot of cases, because dementia is a slower deterioration, and it has to do with an actual organic disease state inside the brain in many cases. Diabetes is another common one that you'll see listed, and it's considered type 2 diabetes if it manifests after childhood. You will also see osteoporosis on here. Osteoporosis is not just with women. Osteoporosis can occur in both sexes. It has to do with your bone density. Typically we see it more in postmenopausal women, but it's not exclusively women. It can be men as well. On here you'll notice that we've got age-related difficulty seeing. And I found this interesting because, this is all about geriatric patients, and they say, after the age of 40. Since I am already past the age of 40, I really didn't consider myself a geriatric patient. But that is when we see those types of changes. So what this really means is not that we've been nearsighted or farsighted, throughout our, growing up years or whatever. This is those nearsighted, farsighted things that don't even start until after the age of 40. So, you might notice having trouble reading close up, things like that. And that's just the very beginning of it. Let's see. Here are some other things, again, like we spoke of, is Alzheimer's. That is, obviously a very debilitating disease. We have basal cell carcinoma. which is a type of skin cancer. So it is typically, one of those things that patients come across with when they, had a lot of exposure to the sun over the years. I know specifically my husband is at risk for basal cell carcinoma because he worked outside. So it's not something that typically metastasizes to other organs. So this is not something that you're going to necessarily, spread throughout your body, but it is considered cancer. Benign prostatic hypertrophy is BPH. This is enlargement of the prostate gland, and it is very, very common, especially in men over the age of 60. Sometimes it goes along with prostate cancer, but this is sometimes a kind of a precursor to prostate cancer. So they want to keep an eye on things like this. Breast cancer is listed on here. It is the leading cause of death in women over the age of 40. We've got things like colorectal cancer listed on here. Some of the degenerative things, degenerative osteoarthritis, which is the arthritis of the actual joints. So we're breaking down the cartilage in the joints, and causing problems there. Let's see. This is another one that you'll see a lot. It's actually the actual disease is herpes zoster, but it's known as shingles. So if you know of anybody who is suffering with shingles, that's the virus that it comes from. Lots of older patients have hip fractures, so you'll see those. An MI is another name for a heart attack. So a myocardial infarction is a heart attack. Let's see, a couple of others. We already talked about prostate cancer. A stroke is another type of problem, and it is a blockage of a blood vessel within the brain. And believe it or not, suicide is a big problem in older adults. A lot of times they find that they don't know how to deal with some of these diseases that they're facing, or that their spouses are facing. So that's, to them, seems to be the only alternative. As you finish up reading through this chapter, make sure you look at the abbreviations that go along with some of these disease states that we talked about. And as always, if you have any problems or questions this week, please make sure you reach out to me. You can send me an email, you can call me, or text me. My number is 618-792-2293. Have a great week.